हेल्थ टॉक शो। आज की भागदौड़ की जिंदगी में हम धन कमाने के चक्कर में अपनी सेहत को भूल जाते हैं। अच्छी सेहत है तो धन कमाया जा सकता है, लेकिन धन से हम सेहत को नहीं कमा सकते। व्यूअर्स, आज का हमारा टॉपिक है ब्रेस्ट केयर अवेयरनेस, विच इज रियली इंपॉर्टेंट फॉर एवरी वुमेन, एज वुमेन इज द बैकबोन ऑफ द फैमिली. If your backbone is fine, you're fit and fine. Before we start our show, I would like to invite my co-host Dr. Anis Kaur, Senior Consultant, Pulmonary Critical Care and COVID team from SurgeonApollo Hospital, Delhi, one of the best hospital in India. Welcome to the show, Dr. Kaur. How are you?
I'm good. Great, Rashmi. Thank you. And this is good morning for you. And it is good evening in India. I'm sitting in London. It's the evening time. It's what? 4:30 in the evening here. Uh, Good to connect like that, three continents. While we're talking, that's the fantasy of this, lockdowns and the the way the life has changed, and we are all on the net and online interviews and even conferences are being held like that. uh Rashmi, as you mentioned, the today's topic is so important, so important for women all over the world. And you're going through breast cancer um, awareness month in the US.
Mhm.
So it's all the more important that we picked up, you picked up, in fact, this topic for this month.
Of course,
And
this is
I
very
picked
important.
I picked up Dr. Rajinder Kaur Saggu for this job.
Yeah.
And she's our expert from Indraprastha Apollo Hospital. And she's been with Apollo Hospital for 12 years now. And good to see you here, Dr. Rajinder. And hope the viewers will be very happy at the end of this talk show, learning a lot of homemade things and awareness things, and what to look for, and when to get alerted about a disease which in initial stages is easy to control and handle and treat, but later on it can be very troublesome and life-threatening. Welcome to you, Dr. Rajinder.
Pleasure is all mine, Dr. Kanwar, and thank you for the invite, sir, and Rashmi. Yeah.
You're welcome, and of course, thanks to both of you and Dr. Kaur. आपको जब से मुझे कहना चाहिए कोविड have started, he has always been there. इंडिया में बैठ के भी वो यूएस वालों की सबकी उन्हें बहुत चिंता है, and he is here with us all the time and spreading his world, of course, worldwide. Thanks to our digital platform, of course, that we can connect people worldwide and spread a word for their awareness of their health to be taken care of. And thank you, Dr. Saggu, and thank you, Dr. Kaur, for being part of our show today. And we really need to share this important information, that health as well.
Yeah, true. Dr. Saggu, why is breast cancer awareness so important? I mean, for a layperson, for the women in general. I mean, why do we say that if you pick it early, if you are aware about that, then you could treat it like that?
See, this is the October month, और अक्टूबर महीने को पिंक अक्टूबर कहा जाता है. और during this month, there is a breast cancer awareness throughout the world. Different तरह के programs होते हैं, different तरह के awareness camps लगते हैं, and we light the monuments also pink. We wear pink, and pink is actually symbol of, pink ribbon is the symbol of breast cancer. And the basic intent behind this is to raise the awareness about the disease. कि हम ब्रेस्ट कैंसर को बहुत अर्ली अगर पकड़ ले तो उसको बहुत आसानी से ट्रीट किया जा सकता है और सर्वाइव किया जा सकता है. So the basically, if we catch the disease early, we can prevent it, we can treat it correctly, and we can save lives. And I think not only in October, ये awareness हमें पूरे साल मनानी चाहिए. पूरे साल हर दिन मनानी चाहिए, 24/7 हमें ये अवेयरनेस हमारे दिमाग में रहनी चाहिए, ताकि हम ब्रेस्ट कैंसर के इंसिडेंस को और कम कर सके और उसकी मोर्टेलिटी और डेथ रेट्स को भी बहुत कम कर सके, ताकि ज्यादा से ज्यादा लोग सर्वाइव कर सके।
Absolutely.
Dr. Rajinder, what is the roughly the incidence and prevalence, let's say prevalence for easy terms, of breast cancer? You must be having some figures in India or global figures.
Yes. You know, breast cancer is a global disease. It means it can happen to any women at any age after the age of 20 and in any country. और basically उसके जो causative factors होते हैं या risk factors होते हैं या symptoms होते हैं वो throughout the world similar है. But there is some difference in statistics. Like Dr. Kaur said, in Indian subcontinent, the incidence is lesser as compared to West. Like in India, we will see that 1 out of every 28 women can have breast cancer during her lifetime. But in West, we have seen that the figures have shown us that 1 out of every 8 women can have breast cancer. And the difference of incidence is huge. But अगर हम mortality की बात करें तो इंडिया में और इंडियन सबकॉन्टिनेंट में the rate is higher. It is seen that 50% of the women lose their life within the 5 year of the diagnosis of the disease. And अगर हम बात करें वेस्ट की तो 90% of the women survive because they are more aware or maybe there are more screening programs. And the third important thing is that in Indian subcontinent, we have more younger population and more younger women are diagnosed with breast cancer. And the problem is that younger women में detection करना और diagnose करना और treat करना थोड़ा सा difficult होता है because the tumor is aggressive and also it is difficult to diagnose in a white background. But remember, there's a good news also. And the good news is that if we detect it early, at stage 0, at stage 1, and to detect it, we just need our hands and our trained mind. And अगर हमने उसको जल्दी पकड़ लिया तो वो completely curable है, तो फिर बस उसको छोटा सा treatment की जरूरत है, लंबा treatment भी नहीं चलता, small surgery, small therapies, and you can be disease free. So the message is detect it early, so and treat it correctly so that we can completely remove this from our lives.
So how often they should go for mammogram?
Yes, this is a very good question. Mammogram is basically a imaging method. Imaging method का मतलब है कि एक X-ray किया जाता है, a simple low dose X-ray to image to scan a breast, right? उसमें we stand in front of a machine and within the 2 plates, the breast is little bit pressed and an X-ray is taken. And it is advised that all women above the 40 years of age, from 40 to 50, they should do a mammogram once in 2 years. And after the age of 50, women should do mammogram once a year. और ये बहुत ही जरूरी है. ये क्यों जरूरी है? क्योंकि mammogram can detect a lump before it becomes palpable. मतलब जब हमें वो हाथ से भी feel नहीं होता और हमें कोई symptom नजर नहीं आता, it is growing silently in our body without our notice. It has given हमारे शरीर में वो दस्तक दे चुका है एक सेल कैंसर का, लेकिन हमें नहीं पता. हम अपनी जिंदगी में मशरूफ है, खुशहाल है, जिंदगी बहुत आसानी से चल रही है, बहुत खुश है, लेकिन वो एक सेल हमारे अंदर कैंसर की दस्तक दे चुका है और वो हमें पता ही नहीं है. हम फील भी करते लेकिन हमें नजर नहीं आता. लेकिन मेमोग्राम एक ऐसा मैजिकल एक्सरे है, वो उस कैंसर को तब पकड़ता है जब हमें नहीं पता चलता. वो इट इज द बेस्ट स्क्रीनिंग मोडालिटी, अ गोल्ड स्टैंडर्ड स्क्रीनिंग मोडालिटी टू डिटेक्ट ब्रेस्ट कैंसर एट स्टेज 0 when it can be completely cured.
So how many stages are there in breast cancer?
Very good. There are basically 5 stages. We start from stage 0. Stage 0 when there are no symptoms, no signs in the breast. Only mammogram can pick it. Then there is a stage 1. Stage 1 में ट्यूमर बहुत छोटा होता है, एक मटर के दाने की तरह, और बगल में कोई गांठ नहीं होती. Just there is a small tumor, right? And it can be very easily cured. The survival rates in stage 0 and stage 1 are more than 99%. बट व्हेन इट गोज टू स्टेज 2, तो वो जो कैंसर है उसके जो कण है वो ब्रेस्ट में से निकलकर वो आर्मपिट में चले जाते हैं, और वो आर्मपिट में लिम्फ नोड में जब कैंसर जाता है तो वो स्टेज 2 हो जाता है, एंड स्टिल द कैंसर कैन बी क्योर्ड, but the survival rates are approximately 80 to 85%. And then comes the stage 3. जब कैंसर के साइज का आकार बढ़ जाता है, लाइक वो 5 सेंटीमीटर का या 7 सेंटीमीटर का हो जाता है, और फिर जो ब्रेस्ट की चमड़ी हो जाती है वो भी थोड़ी सी थिक हो जाती है, उसमें डिंपल्स पड़ जाते हैं, और या फिर जो लिम्फ नोड्स है वो भी बड़े बड़े हो जाते हैं, तो इस स्टेज में को भी हम क्योर कर सकते हैं, बट द सर्वाइवल इज लिटिल लेसर, लाइक इट इज इन द रेंज ऑफ 60 to 70%. बट वन इज स्टेज 4, जब कैंसर ब्रेस्ट से निकलकर आर्मपिट के नोड से निकलकर खून में चला जाता है, और वो खून के जरिए हमारे शरीर के बाकी ऑर्गन्स में चला जाता है, जैसे ब्रेन में गया या लंग्स में गया या बोन में और बाकी ऑर्गन्स में, तो उसको हम स्टेज 4 कहते हैं. एंड स्टेज 4 इज नॉट अ क्योरेबल स्टेज. We can control the disease in stage 4, but we cannot cure it. So that is why it is advised to detect it early so that we can cure it better.
So Rashmi, she hit the nail on the head by saying that in the Western countries, the incidence prevalence is more, yet the mortality is so much less than in India. So simply because the detection is done early there, awareness is more. And probably because of younger population in India, there is another reason that it goes undetected. People are probably not aware that they could fall sick with a breast cancer even at the age in their 30s or so. So they are not really probably so aware about that. And then she so nicely has explained the various stages and the mortality and how the tumor can grow and spread first locally and then to the rest of the body. And likewise, the mortality figures from more than 99% survival in stage 0 and 1, it can keep coming down. And of course, then it is not just a surgery, radiation, and chemotherapy. Everything happens, and yet you can give only a few years of life to the patient in more advanced disease. When do you think that breast cancer screening should be kind of become a routine with people in general, worldwide? So what age, in other words?
By screening, we mean that investigating those women who are normal, means those who do not have any signs and symptoms of any disease. We are getting the test done on them. And basically, there are 3 important tests to be done for screening. The number 1 and the gold standard, which we discussed, is a screening mammogram. The number 2 is a clinical examination by a doctor. All women who are above the age of 40 should go to a doctor once a year to get themselves checked. What will doctor do? Doctor will take a detailed clinical history. He will assess your risk factor, like what is the family history, what is your age, are you married, how many children you have, did you breastfeed your children, and did you take any hormonal pills, what is your weight, and any family history. You have any family history or any genetic component is there? Are you an alcoholic, or you smoke, or you're overweight? So when you take all this type of history, you will be categorized into a low risk group, a average risk group, and a high risk group. And according to your risk, doctor will tell you what type of screening you should be going, whether once a year, twice, once in 2 years, or once in 3 years. This is a clinical examination. Then doctor will examine your breast. What you can miss, doctor can feel it, and will make if there is something wrong, he will tell you to do some investigations. Then there is a third method, which is a very, very simple method, and you can do it at your home. This is known as self-exam, that is breast self-examination. It's a very, very simple method in which you need to train your mind and teach your hands how to do it, how to become familiar with the normal feel and look of the breast. And breast self-examination should be done by all women above the age of 20 once a month. You don't have to do it every day. Once a month is okay. And how you do it? For women who are still menstruating, like who are less than 50 years of age, they can choose one day, 7 days after their periods. 7 to 10 days after the period, the breast becomes soft and supple and it is easier to feel. Before the periods, the breast is lumpy and bumpy और उसमें pain ज़्यादा होता है और उसको feel करने में थोड़े से lumps नजर आते हैं, तो then you get panicked. तो वो नहीं करना है, कोशिश करनी है कि 7th to 10th day में आप breast को feel करें when it is easier to feel for any lumps. For women who have stopped their cycles, like those who are pregnant or those who are breastfeeding or after 50 years of age, they can choose any one day of a month and regularly every month should check their breast on the same date. Suppose you can choose a first Sunday of the month or day 1 of the month, or maybe some ladies remember their birthdays. Suppose your birthday is on the 5th of October, then you can choose select all 5th day of every month and get yours checked. And what you have to check is, maybe we will discuss it in the symptoms part.
Right. What are the warning signs? Now somebody is checking it, okay, the way you have described. But I mean, if somebody is doing clinical examination at home, so what should alert the person in the simplest terms?
Yes. One thing I want to point here is that, and it is very, very important, that there are no early warning signs. It is silently growing inside. It will not produce any signs and symptoms at a very early stage. So at that stage, what is important is screening mammogram. However, as the disease advances, I will tell you 5 important symptoms which you should remember. The number 1 and the most important one is a painless lump in the breast. Usually we ignore the lump कि उसमें पेन नहीं है, दर्द नहीं है, तो डॉक्टर के पास जाने की जरूरत नहीं है. We keep on sitting and we keep on ignoring it. This is not required. You should immediately report it to the doctor. The good news about painless lump is that 80% of the painless lumps are normal. They're non-cancerous. But what is important? The investigation is important. If we investigate it, we will be at least rest assured कि ये normal है. And if it is showing some changes, it can be cured if it is early. Got it? The second symptom is a change in the size and shape of the breast. If you suddenly notice one day that one breast is swollen or increased in size, or one breast is shrunken in size, and it can be because of some changes undergoing inside the breast, and that should not be ignored. और जो third symptom है, which is a change in the direction of the nipple. Usually the nipple is protruded out. और अगर किसी वजह से nipple अंदर को जाना शुरू हो जाए और it gets retracted, it may be because of the small tumor sitting just beneath the nipple. And if you try to pull the nipple out, it's not coming out. So this can be a sign, though you are not able to feel the lump, but there can be just the pulling in of the nipple. And the fourth symptom, there can be some type of discharge coming out from the nipple. Nipple से कुछ किसी भी तरह का discharge. Like there are some physiological normal discharges, like if it is milk or greenish in color or black in color or white in color. Normally this type of discharge, if it is happening from both the breast and multiple points, it is normal. But what is to be remembered, if the discharge is coming from one point, a single breast, and it is blood or blood stained, and it is occurring spontaneously without pressing the nipple, that can be a warning sign of something some initial changes happening in the nipple, like DCIS or stage 0 breast cancer, or some small lump sitting inside the duct. So never ignore that. And the fifth one and the important one is, you might not feel anything in the breast, but you feel something in your armpit. Maybe a lump in the armpit, maybe fullness in the armpit, maybe some uh, other changes in the armpit. You should not ignore that also and immediately report it to your doctor. What is important is that you are your doctor first. Nobody will go to you and tell you that something is happening in your breast and come and get yourself checked. ये आपकी अपनी ड्यूटी है. इफ यू फील यू आर रिस्पॉन्सिबल, अपने आप को रोज मतलब महीने में हर बार एग्जामिन करो, डिटेक्ट इट अर्ली एंड गो टू योर डॉक्टर. टेल योर डॉक्टर दैट डॉक्टर, आई एम नॉट फीलिंग समथिंग राइट इन माय ब्रेस्ट एंड आई वांट to get myself checked. So that is being a responsible woman for and a responsible mother, और अपने लिए और अपनी फैमिली के लिए.
Okay, so one of the viewer had questioned, she is a breastfeeding mom and she feel maybe she has a lump, she's confused. So what should she do, and is any treatment possible as she's a breastfeeding mom? Yeah.
Yes, there's a condition known as gestational breast cancer. It's a breast cancer which happens in lactating mothers and pregnant mothers. I am not going to, मैं उनको डराना नहीं चाहती व्यूअर को. मैं सिर्फ ये बताना चाहती हूँ कि अगर कोई गांठ ब्रेस्ट में नजर आए जब आप दूध पिला रहे हो, तो वो 80 to 90% ऑफ द टाइम दूध की गांठ होती है, जिसको हम कहते हैं कि दिस इज maybe because of some lactation problem, lactational abscess or lactational mastitis. 80 to 90% of the time वो normal होती है. But it should not be ignored. 5 to 10% of the time it can be something else. So आपने इस time क्या करना है? An ultrasound of the breast. Go to your doctor, get yourself checked, और एक अल्ट्रासाउंड करवा लो. और हो सकता है वो एक सिंपल लैक्टेशनल मेस्टाइटिस हो, एक इन्फेक्शन हो, या सिर्फ वो दूध की छोटी सी गांठ हो, और वो कई बार उसको कोई ट्रीटमेंट की भी जरूरत नहीं होती. हम क्या करते हैं कि उसमें कैबेज की लीव्स ठंडी करके वहां पर लगा देते हैं, इट जस्ट गोज अवे, द मेस्टाइटिस गोज अवे एंड यू कैन कंटिन्यू ब्रेस्ट फीडिंग योर चाइल्ड. But if it is something else, in 5 to 10% of the cases, we should be alert and get ourselves checked.
All right. What is this? Is there something called 3D technology? Is it an investigation method?
Yes, a very good question, Dr. Kanwar. Abhi tak, till now we have had 2D mammogram. Like उसमें दो एक्सरे करे जाते हैं, एक साइड टू साइड, एक ऊपर से नीचे, above and below. Only 2D mammogram was available. And nowadays, thanks to the technology, there's an innovation in the better detection of the breast cancer. और एक 3D मैमोग्राम जिसको हम ब्रेस्ट टोमोसिंथेसिस कहते हैं, वो भी अब हमें ब्रेस्ट स्क्रीनिंग में हेल्पफुल है. और ये एक न्यू टेक्नोलॉजी है जिससे हम ब्रेस्ट कैंसर को जल्दी पकड़ सकते हैं और ज्यादा पकड़ सकते हैं एज कंपेयर टू द 2D मैमोग्राम. And what happens in 3D mammogram? Multiple x-rays of the breasts are taken and it forms a 3D image of the breast, which gives a more clearer and better picture as compared to the 2D. And the studies have shown that 3D mammograms, they detect cancer, more number of cancers as compared to 2D, and it detects cancer in denser breast also. And in simple words, I would say that 3D mammogram does not allow breast cancer to hide inside your breast. कहीं भी कुछ भी छुपा हुआ होगा, it will go and catch hold of it, and it is a better modality than 2D mammo.
Is it now available all across, or is it only at hospitals?
It is not available all across, but we have started. Good imaging centers are having it, and in India at least, and at Apollo also we have instituted this last year only, and it's a very good modality to detect breast cancer early in younger women, in younger population, because they have dense breast and we can pick up cancers early.
Right.
So like in
Rashmi,
US, we do have
that's
a facility for mammogram, of course, but India में जैसे कि वहाँ villages है, उनके लिए भी ये है facility या नहीं है provided वहाँ पे?
Yeah, a very good and pertinent question, Rashmi. India में I would say that more than 60-70% population rural area में रहते हैं और जहाँ पर कई बार मेमोग्राफी अवेलेबल नहीं होती है. आप 3D की बात तो दूर की बात है, कई बार 2D मेमोग्राफी अवेलेबल नहीं होता है. और इंडिया में I would want to tell you that Tata Memorial Hospital has conducted a study, a 20-year study on rural women, and they have seen that they have trained some healthcare workers, and they have sent those healthcare workers across to the villages, and they have examined all women over there, the clinical examination of the breast, and they have picked up so many breast cancers, and they have published this study, and they say that clinical examination is the best modality where mammography is not available, especially in developing countries, where we can pick up cancers earlier. Suppose a woman will come to you, the doctor, when the cancer is 7 centimeter or 8 centimeter, but a trained healthcare professional is picking up lump when it is 1 centimeter, when it is 2 centimeter, when it is easier to treat. So the study published has shown that there was 30% less mortality because of the early detection of clinical examination. So we have Indian solutions to Indian problems. We are detecting early with clinical examination and with breast self-examination also. We are doing screening and mass screening in such way in rural areas.
Okay. Super. So,
You have questions from the audience, or you have your own questions?
no, I just wanted to check, like, is there any food specific food should be avoided or anything like, and is weight gain also connected with breast care?
Yes, these are the risk factors actually, Rashmi. There are some risk factors, if I can elaborate them. Unhealthy lifestyle. Basically, lifestyle changes. Unhealthy lifestyle means unhealthy diet, unhealthy weight, and then high cholesterol diet, and not doing exercises regularly, and obviously obesity and increase in weight. These are the risk factors which we can control, and if we control these risk factors, we can not only take care of the cancers but all other chronic conditions of our body like diabetes, hypertension. Dr. Kanwar can elaborate multiple diseases which can be like prevented with the lifestyle change.
Well, obesity is a problem everywhere. I mean, it leads to so much of morbidity in one way or the other. What is the standard approach now that you have diagnosed the patient has clinical symptoms, or mammogram picks it and probably would biopsy it, and you have found that the tumor is cancerous. It's not a benign growth, but a malignant growth. So then, of course, you have already described about the staging. So you have done the staging. So broadly, what is your approach to treatment?
The treatment, it is a multimodality treatment. By multimodality means different modalities. We need surgery and chemotherapy, radiotherapy, hormonal therapy, and targeted therapy. There, we can combine these therapies according to the stage of the disease and according to the type of the disease and the age of the woman and the number of nodes involved. And if we talk of surgery, surgery has shown a complete paradigm shift from last 50 years. 50 years back, there was a trend that a radical mastectomy was done. Whole of the breast along with the underlying muscles was removed, and women was left with a very bad scarred chest, painful. Then came the era of modified radical mastectomy. Only the breast is removed and the muscles are preserved. Still a better, painless procedure. Then came the era of breast conservation surgery, where we just remove the tumor and we preserve the rest of the breast. But still, in that condition, one breast looked smaller and slightly deformed, and cosmetically did look appealing. But sir, now is the era of oncoplastic surgery. अगर किसी को breast में गांठ है, चाहे छोटी है, चाहे बड़ी है, we can do a breast conservation surgery. Oncoplasty combines the oncological principles plus plastic surgery in the same sitting and the reconstruction can be performed on the same time on the same table. And it gives a very good results, a good symmetry of the breast, and women feels happy with the body image. So this is the new innovations, new technology which we are doing nowadays. If we talk of, yes, sir.
Yeah, go on. Sorry.
If we talk of surgery in the armpit, because when we do the surgery of the breast, if there are nodes in the armpit, we have to do the surgery of the armpit also. Now that is also becoming less radical. It is also becoming minimally invasive. Initially, we used to remove all the lymph nodes. Nowadays, if the lymph nodes are not involved, we remove only one or two lymph nodes, do a sentinel lymph node biopsy, and women can go home if she is lymph node negative. So the surgeries are very small. Cosmetically, they look absolutely good, appealing, and women are happy with this type of cosmetic surgeries. Also available in breast cancer means you do not have to lose your breast. You can preserve your breast even if you have breast cancer. Mind it, there is no difference in the survival. मोस्ट ऑफ द टाइम लेडीज का क्वेश्चन होता है कि इफ आई प्रिजर्व माय ब्रेस्ट तो मेरे को ब्रेस्ट कैंसर दोबारा वापस आ जाएगा. द स्टडीज हैव शोन दैट अगर वापस आना है तो मेस्टेक्टमी स्कार में भी उसी टाइम वापस आ सकता है जितना वो नॉर्मल प्रिजर्व ब्रेस्ट में आना है. सो डोंट वरी इफ यू हैव अ ब्रेस्ट कैंसर. Nowadays we can preserve the breast. And if you want to talk of chemotherapy, we have so many new chemotherapeutic drugs which can really kill the microscopic disease which is present inside your body and can prevent the cancer from coming back. And there are some targeted therapies and then hormonal therapies which can also prevent the recurrences and the disease from coming back.
Yeah, actually, one of the viewer wanted to ask, her sister is in India, but they are financially not well. So, is this mammogram very expensive, or जो afford नहीं कर सकते वो कैसे करें उसे?
See, mammogram is the rate of mammogram is different according to the different hospitals, and we have many charitable organizations. We have government hospitals where you can go and get your mammogram done free of cost, and in charitable hospital there are mammography machines and they guide the women who cannot afford it and they can get it done. And especially in the month of October, like maybe 10 days back I organized a camp, and in that camp I had given a discounted coupon to the ladies for a free mammogram. So in the month of October there are so many these awareness programs going where people are giving a free mammography to the ladies who cannot afford it. So tell them to contact any of them, and if they are not able to, then please share my number with them. I will surely organize a memo for her and for anyone else who cannot afford it, because I also run a small NGO where I help women who cannot afford the treatment and the mammogram, and I try to give them surgery. I do surgeries free of cost for them and help them in doing free mammograms also.
Awesome. That is such an informative thing which you have shared. It's amazing, actually. And Dr. Kanwar, one more question I did have from one of my viewers. She wanted to know, for weight loss, she's taking some pills. So, what do you suggest on these pills?
No, not recommended. Those pills have their side effects, and they are to some extent even carcinogens also involved in them. So for weight reduction, two things, just simply two things: exercising, and if somebody cannot do exercise for one reason or the other, the knee problem or the ankle problem, then there is cycling. In some way or the other, some kind of upper body exercises can be done if somebody cannot walk. But burning calories is so important, as is intake of the calories. So your diet has to be very regulated, as much free of fat as possible, not entirely, of course, but the carbohydrates should be low. Relatively, protein should be a little higher, and you should be having the vitamins as well as the antioxidants. But on the whole, the calorie intake has to be less and you have to burn the calories. So we don't believe in the tablets to reduce weight, and so that is not something which is. I mean, people have had them until a few years ago, but because of misgivings about the tablets and the contents of the tablets, it's not in fashion anymore by the physicians. Uh, the if the somebody is morbidly obese, then the surgery, one of the surgeries can be done for weight reduction. But then again, that surgery is also successful only when you have spent 6 months trying for the weight reduction program. If you have not tried the weight reduction program, then the surgery, even after losing initial weight, you can regain the weight again. So those surgeries eventually fail if you haven't given yourself a trial of 6 months of a low calorie and burning of the calories through exercise program. So that is what is the advice currently.
Thank you so much, doctor. And Dr. Sakku, you have really shared so many important information today that how they can be careful and not to be scared, and it can be treated so well, so they don't have to be scared, because a lot of viewers had already mentioned like they're too scared of going to the doctor. They feel some lump is there, but they don't want to go. What's going to happen? They don't know, but it can be cured, and they need not to be scared. That's
Yeah,
amazing.
absolutely. And Dr. Sagu, thank you so much. I'm, so much more and better informed now than I was about the breast cancer issue, and it's been a lot of new knowledge to me. And I'm sure it is for the patients or for the lay public in general. And it's a great awareness program. Thank you so very much, Dr. Sagu. And thank you, Rashmi, once more. And until we meet again, and we'll decide about the next
Definitely.
talk show.
Definitely.
Thank
Thank you
you.
so much. But before we end this show, any message for our viewers, Dr. Sadhu?
Uh, the same message that please don't be afraid of it. You need to be alert and you need to be aware. And when you are aware about, just remember that breast self examination once a month for everyone after 20 years of age, clinical examination once a year after 40 years of age, and mammography definitely once a year after 50 years of age is must for all the women to take care of your health and detect the disease early, and it can save lives. Thank you.
Thank you so much,
Thank
Dr.
you.
Sadhu, and thank you, Dr. Kaur. It was great
Thank you.
to have you
Thank
both
you,
of us,
thank you,
both of you on our
Rashmi.
show. Thank you so much. Thank you, viewers.
Thank
We'll be
you.
back soon.